I want to have a kind of dive into some research that I did before the pandemic, and then we decided to repeat it during the pandemic. Now, if you're listening tonight to this program, I'm sure the staffing and burnout crisis in midwifery and similar professions has not passed you by. And listening to those stories over the past few years was what really kind of inspired me to start thinking about this in terms of lactation and breastfeeding support. It was ignited by that, further kind of flamed by my own experiences in working around breastfeeding support and working in research and academia in this subject area. It also came out of the book that I wrote a few years ago, Why Breastfeeding, Grief and Trauma Matter, that looked at women's experiences when they weren't able to breastfeed for as long as they wanted to. And what was really clear from the research around that book was the impact of trying to work in a system that just doesn't support or value breastfeeding. So thinking about the broader system of necessary funding and sufficient resources and all those social influences and attitudes towards breastfeeding. And to me, it was really clear that so many women were struggling within that system to feed their baby, but also those who were trying to support them were being affected by the same influences as well. And it became even more complex, because often the reason why a lot of people end up in breastfeeding support and lactation support is because of their own difficult experiences in the first place. So they have such a tough time that they go into breastfeeding support absolutely determined to try and make things better for the next generation of women. And of course, they come up across the same problems all over again. And as I'm going to talk about in more depth in a bit, that kind of hurt and grief and loss that they experience gets even more exacerbated by seeing it continue. So I really wanted to try and explore this in those working in lactation support. And we chose the phrase lactation support from the book because it was really thinking about the lactation support role, trying to make it slightly different to the experience of breastfeeding. So we're really thinking about those who are working as lactation consultants, breastfeeding counsellors, breastfeeding peer supporters, midwives and health visitors who are supporting breastfeeding and families, and those working in specialist infant feeding roles. So the research that I did for this project was, well, it ended up being in 2 stages. I never planned to have this in 2 stages. We did the first lot of research in 2019, really exploring how those working in lactation support felt about their role. I never expected to have to or be able to repeat it again during a global pandemic at that point, but that was the way things unfolded. So back in 2019, 727 people who were working in lactation support took part in this. So it was a global study. The majority were from the UK, but there were participants from the US, from Canada, from across Europe, a lot from Southeast Asia, from Australia, New Zealand. It was a really good global mix. In lockdown then, I decided to repeat a smaller version of the study to measure how things may have changed or been affected by the pandemic. And during that first lockdown, so during about the May-June period back in 2020, I repeated the study and 520 people took part. And similarly, they were from all around the world. And what I was measuring in that study was trying to understand how those working in these professional and volunteer roles were feeling about that. So it was very much taking a snapshot of the motivators for working in a role and the positive outcomes for working in that role, but then thinking about some of the stresses and challenges. So alongside the experience questions, I took measures of whether they were feeling burnt out and exhausted in their role or not. But then some of the things that might go alongside that. So I measured empathy, because we know that that is such a big part of any supporting role in healthcare. But what can also end up being tied to higher levels of burnout because we just care so much. And it's an experience that you probably see in your colleagues and friends working in any area of healthcare all the time. I also measured imposter syndrome just because it was one of those things that I know we as women are just so, we have such a tendency sometimes, even when we're in really experienced positions, to still feel that we're just, not doing well enough, and that any minute now a grown-up is going to come along and catch us out and tell us that we shouldn't be doing this. So again, this really featured as quite key within the findings. And then, because I really did not want this to be it's all negative, it's all going to end in disaster kind of research project, I asked questions around, well, okay, so even if this is really stressful, what keeps you going? And that element of the research is just so lovely to read. It's just so affirming, and I'll come back to it now. And again, then, well, what do we need to change? And basically, we need to overthrow the entire system and start again, if that's all right, if anyone can get around to doing that. So just starting off then, I was just really struck within the responses from across those 2 stages of the survey, just how much those working in these lactation support positions got so much joy from the role. So there was so much personal reward in terms of being able to support a new mother, being able to support a family, to see the partner click and understand why breastfeeding was so important, or to see a grandmother's kind of whole way of thinking about how babies should be fed changing. And just some of the quotes here: breastfeeding support is one of the hardest jobs I've ever done, but the most rewarding. And I love what I do and being able to give back and support families. I can't imagine me without it. And it's an absolute privilege to be able to serve families in this role. So even though, as you'll see, participants talked about a lot of stresses and barriers in the role, the real heart of the role of working with families and working one-to-one with women and their babies and their wider family was just so important. It was kept them buoyed as such. It just kept them going, even with the paperwork, even with the bureaucracy, even with the colleague who worked in a different area who really did not understand supporting breastfeeding. However, quite a lot of people in both surveys talked about this really mixed experience. And I just love this quote from this infant feeding lead. So some days it feels like a roller coaster. You're pulling your hair out because you can't organise a room for the peer supporters to run a group, or have heard that yet another mother has been given incorrect advice by another professional. But then you get a thank you card from a grateful family, or see the difference in someone's face when they finally latch their baby on pain-free. Some days when my husband asks me, how was work? I genuinely do not know what to say or where to begin. And even though I'm talking, about working to support breastfeeding here, I think this could be applicable to so many roles and positions across midwifery, across health visiting, across healthcare in general. It's that continual high and low. Days are never boring, but also it's thinking about you within this system and how it's impacting on you. So to go to a slightly more negative outcome from this survey, one of the things that I did within it was measure symptoms of burnout. So the questionnaire that I used had 3 different scales to it. It looks at personal burnout in terms of how you're feeling in terms of yourself. So whether you're feeling emotionally exhausted, physically tired, and then whether you're feeling burnt out and exhausted in terms of your work tasks and your role. So your very kind of specific tasks. And as you can see, quite a high proportion of those in the survey were experiencing these emotions and feelings really, really frequently. There was really quite a high level of emotional and work-related burnout, and this only increased during the pandemic. And I want to really kind of get into that when I can really look at this data. As you would expect, it went up in the pandemic. We all know we were more burnt out, we were all more stressed, there were more demands on those working to support families in every way. And of course, it was further exacerbated by the experience of just living through a pandemic. But these statistics are really quite high, and they're really quite worrying in terms of the pressure on those working in lactation support roles, because clearly a lot of people who were taking part in this research were feeling exhausted and stressed, and like a lot of the roles that they were doing day to day and the tasks they were doing day to day were leaving them feeling really frustrated and just really burnt out because of the work. And we know this is a worry because we know that when people start getting burnt out, not only is it awful for their mental health, but they can end up going off sick. They can end up with all sorts of stress-related health issues. They can end up with what is known as compassion fatigue, where they almost run out of care, that, you know, the compassion that they feel for the families goes. We also know people end up leaving and going to a different career altogether, and we lose good people due to the stresses of the job. Now, that was the one side of it. But when I came to the third scale, which specifically looked at the experience of working with families, everything turned around. So those statistics on the previous screen, you're looking at 50, 60, 70% of lactation supporters with symptoms of burnout in related to their personal exhaustion and their work task related exhaustion. When you turn it around and you look at families, it's really, really low. It's not the core role of supporting families and engaging with families and working to support breastfeeding and mothers and having that one-to-one care that is bringing people down at all. There are a very small percentage here. So 5% finding it hard to work with families, finding it frustrating, feeling drained of energy by working with families. And this is very, very similar data to other research from around the world that has looked at burnout in midwives and burnout in nurses, in that the levels of personal and work task related burnout are high. But when it comes to the core role of what you came into the professional volunteer post to do in the first place, when it comes to that compassionate role, that supporting role, then it eases. It's not that at all. And it's ironic in a way, well, fully ironic really, that the reason people come is not stressing them, is not burning them out. It's all the other stuff that goes alongside it. So the barriers and the paperwork and feeling the bureaucracy and all of that. So in terms of what is so stressful about working in lactation support, there is so much, and I could go on all evening and you will probably cut me off. I think I could go on to at least the next day in talking about this. So I'm just going to pull out a few of the quotes and a few of the issues. It is so reflective of the situation that women are facing when they're trying to breastfeed. So whenever I talk about, the barriers to breastfeeding, I'm always talking about a lack of government investment. So don't have the funding in place to give every woman who needs it support. We don't have sufficient funding into midwifery and health visiting and lactation specialist roles. And that affects women's ability to get the support they need to continue, but it also adds to the stress and the feelings of burnout of those trying to work within the profession and volunteer within those communities when there isn't enough investment and support coming in. So just here, one of the lactation consultants said, it's demoralizing when politicians sitting in their offices and who never see families reduce budgets or fail to support policy. They don't see the fallout in our communities, yet hold all the power. And it's the day-to-day experience of feeling that you have to protect women and you have to create a safe space for them when that society that you're working in isn't valuing it and you aren't getting the support that you need. And closely linked to that is the lack of societal understanding about breastfeeding. So all the culture around not understanding normal baby behaviour, thinking everything is the fault of breastfeeding or thinking everything is solved with a bottle of formula. And a lot of peer supporters in particular in the study really talked about all the time that was spent trying to talk about and evidence and push back against incorrect information that was coming in. So trying to explain that the formula adverts weren't telling the truth, and that the family member who said that if you just put the baby on formula that they're going to sleep. So it felt like a mother came into breastfeeding peer support group and needed support with her latch, but actually you had to unpick a load of other things before you could even begin to support the latch. And the feeling that you're continually working against that system that's kind of coming down against you. The other issue, a big issue, is the criticism and the conflict, especially on social media. So a lot of people who took part in both surveys were saying it was so difficult to be attacked online. Trolls coming along and accusing them of things that weren't true, of seeing countless news articles and headlines where researchers got misconstrued, or social media at the moment where formula companies are deliberately working with influencers on Instagram to try and convince everybody that dads need to give a bottle in order to ever be able to bond with their baby. That's my bugbear at the moment. There's a whole big campaign going on there. And it was just feeling that there was so much pushback coming. And the other element was when working alongside colleagues who did not understand. So they weren't in infant feeding roles, or they're in different professional roles, and they didn't see the importance of breastfeeding to women, and they didn't believe that breastfeeding was important, and that they deliberately worked to undermine what you were doing, or override instructions that you give, and you end up picking up the pieces of when you come back in the next morning, and somebody has given complete different instructions on how that baby should be fed, and you know that it's really damaged a mother's breastfeeding experience. The other element is just the Groundhog Day of it, of seeing the same misinformation on social media and the same criticisms coming up on social media all the time, and continually feeling that you're pushing back against it. And every time you solve one area and give some correct information and support, something else comes back up again. One of the respondents said to me, I said to them, what would you change in lactation support? I'm sorry, I can't give you a lottery win to fund this. And they'd written, they said, well, you might not be able to give us a lottery win, but can we just have the same money and investment that the formula industry does? Followed by, oh yeah, there's more chance of winning the lottery, isn't there? So it's kind of just thinking about the continual things kind of grinding people down, when at the heart of it, and what you're trying to protect and create that safe space for the families who you love working with, and you get so much personal reward and satisfaction, but it's like you're having to hold up a huge umbrella over them and try and protect them from these industry messaging and people who don't understand breastfeeding and a lack of support, whilst also sort of battling that system yourself. One of the biggest things for me in this survey was the sheer amount of empathy that those who are working and volunteering in lactation support have. So I took a measure of how empathetic respondents were in the survey. So it was really looking at the tendency to, take on other people's emotions and really feel how they're feeling, and your ability to understand the emotions and the experiences of those around you. As you can imagine, being really, really empathetic is a bit of a double-edged sword when it comes to working in lactation support or midwifery or health visiting or any caring profession, because a tendency to be really high in empathy means that you're really, really good at your job most of the time, because you understand people's experiences and you understand what they're going through, and you can reflect back to them and really help them process how they're feeling. The kind of other side of that is that you often carry the weight of the world on your shoulders because you absorb other people's emotions. And I remember one woman in the survey saying something like she carried the weight of all the women that she was supporting. and that she felt like she couldn't put it down, that she was trying to carry all their stresses and all their grief and all their loss for them, and that was impacting on her. So when I measured empathy in the survey, I'd used a measure which had a cut-off average point, and absolutely everybody scored above average. There wasn't a single respondent who had lower than average empathy. And actually a big chunk of them were really, really high. And of course, it's those skills that make all the difference. And, you know, just the quotes here, my heart has broken alongside so many mothers over the years who haven't been able to breastfeed, and really feeling that experience. And I have to say, it's one of the biggest things that overwhelms me in working in infant feeding research, that you hear so many distressing stories. So when I look at things like breastfeeding grief and why women haven't been able to breastfeed, just the depth of the emotion in that, and reading those stories day after day and after day is really overwhelming. I mean, it's such a privilege to hear, and I'm so grateful to have that data and be able to talk about it, but also I can understand the emotional weight of it. And I say in the book, and I've said a few times to people, you know, I always wanted to be a clinical psychologist. I wanted to work and support people in mental health, but I decided that would be too overwhelming with me due to quite a high tendency to have a lot of empathy. So I thought I'd be a researcher instead, and go into breastfeeding research, where it was probably more distressing than any other area. But it's this tendency, and the reason why is because so many people end up in lactation support because of their own distressing feeding experiences. So there's a bit of a myth amongst some people on social media, going back to the social media conflict slide, that people end up in breastfeeding support because they've had really easy experiences and they just want everybody to act like them. So we're all going to go and skip through a field with daisies feeding our babies. It's going to be that easy. But that's usually completely as far from the truth as you can get. I'm sure there are people who have had really straightforward experiences, but most people end up working and volunteering in this field because they've realized that there is a big support gap, or they've had their own difficulties, or they've just really been so distressed by their own experience of having to stop before they're ready, or bringing in and using formula before they're ready, that they just want to try and stop anybody else from feeling that way. The other element of this is the very high tendency of many in the survey to score highly on imposter syndrome. So this concept of never feeling good enough and always doubting yourself. And so many people within the survey said that they spent a lot of time at the end of the day playing over and over in their heads all the conversations that they'd had, thinking, did I do enough? Did I say the right thing? Who am I to be working within this role? It was so common. And of course, you know, the experience in itself of doubting yourself probably means you're absolutely brilliant for the role, because you're questioning yourself and it means so much to you. But, you know, just one of the peer supporters here, where it feels like what I say carries too much weight. What if I get it wrong? So you're really worried that there's not enough support for mothers. You really care about them. You really care about breastfeeding, and then you're worried about it yourself. So no wonder people are feeling overwhelmed. However, saying all of that, and I'm just keeping an eye on the time before I do go on all evening, thinking about one of the big things I asked them was, why do you stay in your role? Not as in why on earth do you stay, but why do you stay? What are the good parts about this? And this chapter in the book is just such a pleasure to read. It is just so lovely, kind of spending that time reflecting on just how wonderful a role like this can be, even if there's a lack of support for it and a lack of understanding of it, and fights are breaking out on social media. Actually, when you come back to it and think about that core role of supporting families. And this one at the top here, I serve women for whom breastfeeding is an integral part of their recovery, including those who've experienced sexual abuse and violence. Simply, I could never give up on them. It would destroy them to be failed by me too. Others talked about spending time on neonatal units, on paediatric units where mothers were fighting and fighting to get their baby fed, and a baby was fighting for their life, or an older child was really unwell. And they were just talking about the sheer privilege and responsibility of being able to be there and make that difference. And just related to these here, nothing will ever be better than the feeling you get when you fix someone's pain or help them feel less anxious. And the pride as well. And this is something that, when I was reading more broadly around this area, really comes out in midwifery and nursing too, you know, that real pride of being in your role. So I love being able to call myself an IBCLC and being able to call this group of professionals from around the world my colleagues. And what was really clear within the data was that although conflict on social media and with some colleagues who didn't understand breastfeeding was common, there was just a real connection within the field. So virtually everybody in the survey said they had that one person, that one really close colleague and peer who you could offload to, who you could share everything with, who kept you going and kept you buoyed up. And you just knew you would not be in your position now if you didn't have their friendship and their support. So it's just thinking about that connection as well. In terms of protecting ourselves, one of the questions I asked, and it feels like cheating a little bit, but I asked everybody, well, what can we actually do? What can we actually do to support our own mental health here and make sure that we don't burn out? I think my very favourite quote referred to, we all need to spend more time in a hot tub with a gin. It seemed to be, you know, that's the title of a book in itself. But just some of the things in place. So realise, and some of these, the peer supporters in particular, were so eloquent in terms of just getting us to step back and think about how we talk to ourselves and don't criticize ourselves and don't put the pressure on ourselves. And this quote here, so realise we can only do so much and we aren't responsible for all of infant feeding. If we make a difference to one mum, then we're winning. So it's about reframing things. Boundaries here, boundaries are extremely important. It's vital to me that I have a life outside of breastfeeding and live it. And so many tips around, you know, having separate phones, putting strict limits on your social media, trying to get around that if you can, and spending that time looking after yourself. And one of the reasons that we called it the compassion code when were writing the book was that compassion is at the heart of what everybody working and volunteering in lactation support does. Is compassion for the mothers, for the babies, for the families, for breastfeeding in general. But what many of us need to take a lesson in our own compassion and treat ourselves that way. And quite a few of the respondents in the survey just simply said we need to treat ourselves with the same kindness that we treat the mothers that we care for. And I spend a lot of time talking to mothers who haven't been able to breastfeed and saying, look, you didn't fail, it was the system that failed you. And if you're working in lactation support and you're thinking you're failing, it's reminding to apply the same messages that we say to parents all the time. You know, you did not fail, you were failed by the system, you're fighting these barriers around you. And coming back here just to the importance of those good working relationships with other breastfeeding supporters, we're stronger together. And it's really focusing on the good people. There might be so many people out there not understanding and criticizing and sending you personal messages, accusing you of things and being nasty and trolling. But actually think of those good people around you, those connections, that one person. Listen to them. It's Professor Brené Brown, who I always bring up. I've got all her books. If you haven't read those, you need to go and read those. Around, she's got a little exercise where she talks about having a little piece of paper in her wallet with the names of the 5 top people she actually cares about. And whenever she's criticized or feels low about something, she thinks of those 5 names and thinks, well, what would these 5 people who are really important to me think? Would they be criticizing me? Do people who are not on this piece of paper actually really matter? It's these people I should be listening to. So I unfortunately cannot go out, gone all night, but just to talk a little bit about the book, it is out next week. I really wanted to draw attention to the cover because it is by the brilliant artist Leanne Pierce, who has been designing covers for us, and just to make sure that we all shout her name as well. So if you would like to get a copy, it's available on Kindle for pre-order. It will be on Amazon next week, or a signed copy from me from my website to add to your collection. So thank you.